好，歡迎大
Welcome to the press briefing today. It is about the vaccination program for COVID-19. Allow me to introduce the three secretaries on stage. We have Secretary for Civil Service, Mr. Patrick Nip, Secretary for Food and Health, Professor Sophia Chen, and Secretary for Education, Mr. Kevin Yeung. Mr. Patrick Nip will first deliver an opening remark. Good afternoon, members of the public and media friends. It is the 105th day since the implementation of the COVID-19 vaccination program on the 26th of February. Since the implementation of the vaccination program, we have made regard to the changing epidemic situation, supply and demand of vaccines, and we have also paid regard to expert opinions and gradually extended the vaccination groups to provide the maximum protection for our citizens. On the 15th of April, we have announced that the coverage of the vaccination program will be extended to cover young people and adults between the age of 16 and 29. On the 3rd of June, having regard to the advice provided by the expert advisory panel, the Secretary for Food and Health approved to lower the age limit to receive the Comirnaty vaccine from 16 to 12 years of age, so that the vaccination program has been extended to adolescents between 12 and 15. We estimated that the population is around 240,000 people. Having lowered the age limits, the population eligible for vaccination at age 12 or above will increase to 6.82 million people. Concerning lowering the age limits of receiving Comirnaty vaccine to the age of 12, the Joint Scientific Committee and the Expert Advisory Panel have met yesterday. They agree that the Comirnaty vaccine is highly efficient in protecting against symptomatic COVID-19 virus, and it is highly efficient in protecting adolescents from being infected by the COVID. And also, it is very important to lower the risk of transmission in the community, and also it will enhance the overall immunity of the community. The government attaches high importance to getting adolescents and students vaccinated, and it is the government's hope that more students, parents, and teachers will be vaccinated. That's why we have made special arrangements to provide different options for students and parents to get vaccinated. These options include the following. The first option, which is the simplest option, is to make a booking yourselves on our thematic website to receive Comirnaty vaccination in the 24 community vaccination centers. The second option is to provide special arrangements and transportation services to arrange for students to be vaccinated in community vaccination centers. The third option is to provide outreach on-site vaccination service at schools. I will now briefly explain the arrangements for each option. The first option is to make a booking online yourselves. Adolescents between the age of 12 and 15 can begin to make a booking starting tomorrow, that is 11th of June, 9 a.m., through the booking system on our thematic website, which is www.covidvaccine.gov.hk, to make a booking to receive Comirnaty vaccination in the 24 community vaccination centers on next Monday, that is the 14th of June, the Dun Festival, or later. I would bring it to the attention to the adolescents and their parents who would like to get vaccinated. Similar to those between age 16 and 17, the young people have to bring a written parent's approval with them to the vaccination centers to get vaccinated. A template can be downloaded from our vaccination thematic website. The second option is to make special arrangements and transportation arrangements for schools to between schools and vaccination centers. There are many community vaccination centers near schools, and the distance are usually very near. For some schools, students can walk to these vaccination centers, and some only requires a 20 minutes drive. And also, as the community vaccination centers, they are manned with expert medical teams with the proper equipment. We welcome school to arrange for the students to go to these centers to get vaccinated. We will reserve time slots for schools, and also we will arrange coach buses to arrange transportation for teaching staffs, students and parents to and from the vaccination centers. This is the most convenient and flexible arrangement. The third option is outreach vaccination service on site. If a certain number of teaching staff, students and parents at the school opt for vaccination, while the school can provide appropriate venue and cleansing arrangements, then the government can arrange for outreach vaccination service. The service will be provided by the medical team operating the vaccination centers. Concerning options 2 and 3, the government will issue letters to all secondary and primary schools to explain the details. We expect that on 21st of June, the soonest we can make arrangements for transportation for teaching staff, parents, and students to be vaccinated at vaccination centers, while outreaching services will begin on the 28th of June. We believe that the above arrangements will greatly facilitate schools, teachers, and parents to arrange for vaccination for the students. Besides getting young people vaccinated, the vaccination program requires the universal support from all members of the public. As at 1 p.m. today, some 1.62 million population has received the first vaccine dose, accounting for 24.7% of the population aged 16 years old or above. The total number of vaccine doses administered is 2.766 million. The number is far below the number required to achieve herd immunity. Members of the public, we have spent 69 days since our implementation of the program, and on the 5th of May, we have administered 1 million doses to our population. However, we don't have another 69 days for our members of the public to get vaccinated. Vaccines are safe. The 2 kinds of vaccines provided by the Hong Kong government are approved for emergency use by the WHO. Globally, 2.2 billion vaccine doses have been administered, and extraordinary protection and medical effects have been achieved. The justifications for receiving vaccination are clear. We need to build up a protective barrier, and the coming next months are crucial. We need everyone to roll up their sleeves and get the first dose before the end of August so as to protect yourselves and your family members. Let's get early vaccination for all. Thank you.
Professor Chan, please. Good afternoon, everyone. Currently, the government has procured altogether 15 million doses of authorized vaccines for emergency use for COVID-19, which is sufficient for the use of our entire population. Having considered the professional advice of the advisory panel on COVID-19 vaccine, as well as the public threat posed by the current epidemic situation, on the 3rd of June, I have approved the lowering of age limit of the use of Comirnaty to the age of 12. After the relaxation, as Mr. Nip has said, about 240,000 adolescents will be eligible for Comirnaty vaccination. According to the data supplied by Fosun Pharma, those aged between 12 and 15 who have received both doses of vaccination will receive marked protective barrier from the vaccination. And the antibodies generated is also higher than that in adults. They can achieve 100% protection. The Joint Scientific Committee, as well as the Chief Executive's Expert Advisory Panel, has had a meeting to discuss about the lowering of age limit of Comirnaty to 12 years old. They agree that in relation to the protection against symptomatic COVID-19 infection as well as the reduction of community transmission, the act to lower the age limit is very important. So this is also important to increasing the general immunity in the community. As a result, the expert advisory panel and the scientific committee agreed to lower the age of Comirnaty to those between the age of 12 and 15. In fact, a number of overseas drug regulatory bodies, including those in Canada, America, the EU, Singapore, and the UK, have approved the lowering of age limit of the use of Comirnaty. All in all, the benefit of lowering the age limit of Comirnaty is greater than the risk. It can protect our adolescents from infection. It will also help them to go back to schools for their normal lives as soon as possible. Of course, we understand the concern expressed by the community in relation to safety of vaccines. According to information supplied by Fosun Pharma, the side effect of the vaccine among those between the age of 12 and 15 is similar to adults. The side effects are mainly pain at the local site as well as lethargy and headache. But in relation to overseas reports, we have been monitoring the situation. We also ask the hospital authority to collect information and data on the age group in question. The Joint Scientific Committee as well as the expert advisory panel agree that relevant reports should be monitored. I have lowered the age of eligibility of Comirnaty to the age of 12 on the 3rd of June. I have received support from relevant sectors, pediatric sectors and associations of pediatricians have also agreed with my move. Relevant organizations and medical bodies will liaise with schools. They will be happy to answer questions. And they will also be more than happy to disseminate the information. I appeal to schools to actively participate in the vaccination program. Students should be encouraged to receive the vaccination. I have also sent letters to deans of medical schools of universities as well as heads of nursing and related faculties of tertiary educational institutions. I asked them to appeal to everyone to go back to their secondary school to share their experience in the secondary schools to dispel their concerns. Last week, there was the emergence of a local unlinked case involving highly transmissible mutant strain. And this has sounded an alarm for our epidemic situation. We're on the verge of another outbreak. Since the outbreak of COVID-19 last year, school life of youngsters have been affected. In order to create a safe learning environment and the conditions to return to normality at school, I ask parents to make arrangements for their children between the age of 12 and 15 to get vaccinated. We have to all work together to help build a protective barrier to take Hong Kong out of the doldrums. So I ask you all to get vaccinated. Now we'll open the floor for questions. Please identify yourself and your organization before you ask questions. The lady in the second row in light blue. I'm from TVB. I have a number of questions. First, just now you mentioned about parents and taking their children to get vaccinated. Does it mean that parents will have to get vaccinated at the same time or what? The second question. Well, would there be difference in the anti-infection measures between schools with a high vaccination rate and those with a low vaccination rate? Well, previously it's said that if there are restrictions in relation to those who have not been vaccinated to go back to school, it is difficult to implement. Well, will it be the same when it comes to low vaccination rate among teachers? We will provide different ways to facilitate teachers, teaching staff, students, and parents to get vaccinated. We make arrangements for transportation service and block booking at community vaccination centers. If schools receive the outreach vaccination program, apart from students, if parents and teachers would like to get vaccinated under the outreach program, they can also do it as well. So it's not compulsory that students and parents have to do it together. It's just that if parents would like to, they can also get vaccinated under the outreach program. We ask you all to get vaccinated as soon as possible. To answer your second and your third question in relation to resumption of school activities, half-day classes, we have considered a number of factors. That include advice of experts, preparation of schools, and the COVID situation in Hong Kong. We've required everyone to wear a mask at school, to wash their hands regularly, and certain restrictions. We currently only allow half-day classes because we think that taking your mask off to eat at lunchtime is high risk. As the advisory panel said, if there is a high vaccination rate at a certain school, of course the situation would be different from one with a lower rate. If a school has about 70 to 80% of vaccination rate, there will be favorable conditions for that school to resume full activity. This is our line of thinking, but still we have time before the start of the next school year in September. We need to take into account the overall situation. If we can all get vaccinated to boost our overall vaccination rate, this will enable us to keep the COVID situation under control. It's not just schools that can resume normal activities. Other sectors may also return to normality. Everything we have been doing aimed towards getting more people to get vaccinated so that activities of all sorts can return to normal. You ask whether there will be difference in treatment between those who have been vaccinated and those who have not. Of course, there will be a difference in different sectors. In the context of a school, when it comes to resumption of class activities, there will be a difference between those who have been vaccinated and those who have not. But we have to take everything into consideration. If a teacher, for some reason, cannot get vaccinated, will there be alternatives? Say, for example, a regular test. We will use the time we have to consider it thoroughly. We will take into account the advice of experts and thoroughly consider all the factors. Next question. The lady in white.
English News, 3 questions. First question to Civil Service Secretary. The new arrangement that the government suggested, including outreach vaccination services in school, but it will soon be summer holiday. So how likely the measure is effective to boost the vaccination rate? And the second question to Education Secretary, how likely is possible to relax restriction at secondary school if schools achieve, let's say, 70% or a certain level of vaccination rate? And the last question to Health Secretary. Expert panel said yesterday that the government should aim at vaccinating children as young as 6. So how likely the government will look for further lowering the eligible age range for children to get jabs? Thank you.
Okay. Thank you very much. Regarding your first questions, we provide 3 different channels to facilitate students, teachers, and parents to get vaccinated. So outreach service is one of them. So if the schools could make such arrangement, of course, if during a school term, that would be much better. But if during holiday and they are able to gather sufficient numbers of students, teachers, and parents, then we can arrange the outreach vaccination service. So we'll do this in the next few months. The overall objective is to facilitate their vaccination. But of course, they need to do some preparation, coordinations, and communications. So we believe that the 3 different types of channels could be able to provide very flexible arrangements for schools.
On the second question about secondary schools with vaccination rates of over 70%, I think when we decide what could be done at a school and what could not be done, we need to consider the overall situation of the pandemic, the preparedness of the individual schools and or the overall school sector, as well as the advice from the experts. From the advice of the expert committee yesterday, said that for those with a rate of vaccination of 70 to 80%, it's likely that the school is prepared for a full day resumption of full day schooling if the situation is roughly as at today. So we will be considering the mode of operation along this direction. But of course, we have to make the final decision closer to the time, considering the overall situation of the pandemic. So I would like to appeal to every member of the community for the good of the students as well as other members of the community. We should take the opportunity to take the vaccination as soon as possible.
Okay, regarding your third question about lowering the children's age in terms of vaccination. So far, we have received these data from BioNTech, and therefore both the expert advisory panel have already recommended to the government, and I have already approved the vaccination and further supported by the Joint Scientific Committee. So far, the data that support is the lowering of the age to 12 years old. Whether we can further lower the age of vaccination depends on the data, the scientific data that we will be receiving from both vaccine manufacturers as to whether there are evidence to support the safety, efficacy, and also quality of the vaccine towards vaccinating lower children's age. So we will continue to monitor the situation and ask these vaccine manufacturers to provide us with the data and further information so that our expert advisory panel can further scrutinize the data. And once this is done, then recommendations will be made to the government. Thank you.
Next question, please. The lady over there. Good afternoon. I'm from Hong Kong Economic Times. About the outreach vaccination program, you said there has to be a certain number of people opting for vaccination before such outreach service will be provided. So what's the number? So the population of young people is estimated to be 240,000. So what do you think their response will be? There are 3 channels. So which channel do you think would be most preferable to them? And how can we make sure that they will not all go to make a booking at one go? So concerning vaccination after September at private clinics, will there only be Sinovac vaccines offered to members of the public? Concerning fatal cases or death cases after the immunization, the committee, the experts committee on clinical assessments on events following immunization said these fatal cases which do not have a link with vaccination should not be announced. However, Professor Yun said these cases should be announced. So what do you think? So 3 questions. We have already started outreach vaccination services for corporations and different organizations. So we have the experience in doing that. For school, it is also feasible, provided that there is an appropriate venue and adequate number of people. We have to arrange for the medical teams and the administrative staff to go to the school to provide vaccination with all the equipment. Now, the number we are looking at is 300 for one school. Then we can administer the vaccine doses within 1 day. That is our preliminary plan. I have been talking with school principals and the stakeholders. Some say it is feasible. There are outreach vaccination can be even provided to more than one school in one go if these schools are nearby. So the major consideration is to provide convenience to schools. However, we have so many schools in Hong Kong and we only have a limited number of manpower. We would like to make the best use of our resources. So for schools which are already ready, there are already 300 or more who opt to get vaccinated. We would provide outreach vaccination service to them first. And for the other ones with fewer numbers, they will have to wait a bit. So for schools with 20 or 30 people who want to get vaccinated, we will make reservation for them and arrange for transportation for them to get vaccinated. From Monday to Friday, there is definitely enough capacity for community vaccination centers to deal with the extra workload. So this is one way to utilize our resources. For those who would like to get vaccinated as soon as possible, they can start making a booking tomorrow, and then they can receive the vaccination on Monday, which is a public holiday. We have considered that it would be more convenient for parents to go to vaccination centers with their children on a public holiday. So booking can be made tomorrow. So concerning the response of the public, we have to wait and see. But the goal is to get as many people as possible to get vaccinated. Concerning the situation after September, we have 24 community vaccination centers which will cease operation by the end of September. So if you want to get Comirnaty for the first dose, you can get it before the end of October, and then you can get the second dose in September. And then we will close the 24 community vaccination centers for Comirnaty. For other venues like private clinics or other medical bodies venues, there will also be Comirnaty available. However, the capacity will not be nearly as high as those provided by the 24 community vaccination centers. And also there are people with underlying diseases and because of their personal conditions who would like to get the jab, but there is not enough time to get the second dose. We will definitely make arrangements to cater for the needs of these people. So you can definitely get Sinovac from private clinics. For Comirnaty, it depends on the relevant venues and the arrangement. In short, if you are in good health, if you can basically get vaccinated at any time, please get the first dose before the end of August. Concerning the third question, I have to stress that since day one, concerning the information relating to the vaccination program, we have been very transparent and open with the information. That's why we have been publishing very clear data and information concerning vaccination. On the other hand, after several months of vaccination, we have to adjust the way we publish the information. For example, for death cases, if the death cases happen after vaccination and yet we cannot establish the causal link between vaccination and death case, which there is often not, then we will not make public these cases immediately. However, if we think there's a link, we would definitely make public the cases. It is not that we are not publishing the figure. Regularly, we are issuing a report since July on our thematic website. And also, every week, we issue a press release summarizing the adverse events reported to us in the past week. And also, we have compared the occurrence of such cases among those vaccinated and those unvaccinated. So we have drawn experience from the way we have been reporting the figures and then made adjustments. These figures are available to all. And also in our daily press release, we used to report each ambulance transfer from vaccination center to public hospitals, and we would tell the public what's the condition for every case. However, after 3 months, we realized that most of those cases are common reactions after immunization. Often, these cases would be discharged with or without the hospital's approval within the same day. So we have adjusted the way we publish the figure. Let's say 30,000 people are getting vaccinated each day, and then there are 10 cases requiring ambulance transfer because of common side effects and are discharged within the same day, then it makes no point to publish them. However, for serious adverse events, we would definitely publish the cases. So, like Dr. Chow said, there are people who only see the trees but not the forest. The principle is the same. We are dealing with the information in a transparent manner. Sorry, the speaker is not coming through. After September, for specific groups who still need the jab, we will cater for their needs. However, for the majority of members of the public, they should seize the opportunity to get the first dose before the end of August.
I'd like to supplement that in relation to the Expert Committee on Clinical Events following COVID-19 immunization, so far they have not identified any case, any adverse event cases that has a causal link with vaccination. So far they have not identified any abnormality. Of course, they will continue to monitor the situation and collect data and information for assessment. The lady in white in the second row. I'm from Ming Pao. I'd like to ask about the outreach vaccination program. Can you tell us the conditions of schools as a venue? How big are they? Students between the age of 12 and 15 will have to get their first dose before the end of August. Is that right? Mr. Yang, do you have any information in relation to the overall vaccination rate among teachers? And a question for Professor Chen. Previously, Professor Yun said that in order to avoid the misconception that youngsters will have serious side effects from vaccination, then they should provide information on the background incidence rate. Can you give us the information today? Say, for example, serious cases of myocarditis. In relation to outreach vaccination program, well, we have been doing it to private organizations. So we need a venue of at least 1,500 1,500 square foot. We need an observation area. We need a rest area. We need an area for dilution and extraction of vaccination, and we also need an area for equipment. I believe that it is not difficult for schools to make similar arrangements. We will conduct site visits. When we have sufficient manpower, we will do it. In relation to the lowering of age limit to 12, we hope that they will make use of June, July, and August to get vaccinated. Going to the community vaccination center is one of the ways. These centers will continue to operate in these few months. I believe that in the coming 3 months, all the way to the end of September, there is sufficient time for you all to get vaccinated. In relation to teachers' vaccination rate, at the end of April and the beginning of May, we conducted a survey. We asked schools in Hong Kong the vaccination rate as at the 3rd of May. We have reported the percentage, which is 18% to let go, but that is as at the 3rd of May. We have not conducted the second survey. I believe that we will have more accurate information from schools because of the recent program. Yesterday, the Joint Scientific Committee and the expert advisory panel have gone over overseas experience of the use of vaccines, say for example, Comirnaty. We have asked the hospital authority to collect information for the age group 12 to 15 on information such as myocarditis, which is a rare condition. We have already asked the hospital authority to collect information on the occurrence of this disease of that age group in people who have not received any vaccination. The information will be used for monitoring purpose and comparison purpose when we have started vaccination of those between the age of 12 and 15. I don't have the information at hand, but it's something that is ready for our use. The lady in white, I'm from the Apple Daily. First, Mr. Young, you talk about the difference in anti-infection measures between schools with vaccination and those without. Well, we said that there will be 28 days zero infection. Are you sure that that will continue? Are you concerned about any adverse opinion in relation to this? Professor Chen, you said that you've got support from pediatricians, but parents are still concerned. Will you arrange for pediatricians to give explanations at site? There are organizations offering lucky draws to boost vaccination rate. Why don't you make arrangements for doctors to provide consultations before vaccination? Because if you do it in the private sector, you will have to pay. Can you tell us more clearly? You said that at the end of September, these community centers will cease operation except for specific groups. That means for adults and those between the age of 6 and 12, if should the age limit be lowered, would they still be able to get free vaccination, or do they have to pay? In relation to what activities can be conducted at schools, I have already said that there are 3 factors: COVID situation, preparation of schools, as well as opinions of experts. Of course, a higher vaccination rate is better. There will be a difference in anti-infection measures. But as to what can be done and what not, we have to take into account the overall COVID situation. If it's lucky that there are no cases for a certain period of time, our consideration will be different from the situation where there are cases continuously. That's why I said that we have to take into account all factors before we make an overall decision. As we've said, and as experts have said, if a school has a vaccination rate of 70 to 80%, then they have the condition to resume full-day classes. As to the specifics, we will, in due course, make an announcement. I believe that getting vaccination is a way to protect yourself, your family, your friends, and also a responsible act to your community. Don't elevate it to a different level, such as discrimination against people who have not been vaccinated. You have to think that you're doing something for the good of the society as a whole. In relation to the College of Pediatricians and whether pediatricians will explain to parents, well, my understanding is that they have issued a statement expressing their support. They agree that vaccination will protect children and the benefits outweigh the risk. In relation to the explanation by them, yes, that is very important. My understanding is that the preparations are being made to explain the situation better to parents. As to whether there are things that the government can do to explain to the public better. General outpatient clinics, district health centers, well, so far we only have one, which is in Kwai Ching, places where members of the public can go there to get advice. We produce APIs. The Department of Health has cooperated with doctors to produce programs at the RTHK to talk about dedicated topics to dispel concerns in relation to vaccination.
Allow me to supplement concerning the vaccination program. The age is lower to those between 12 and 15 in schools. This requires cross-sector collaboration. Besides schools, it is most important for the medical and health sectors to chip in. So we have been meeting with school principals as well as the Hong Kong Pediatrician Society and so on. And everyone is willing to do their part. For outreach vaccination programs or arranging parents and students and teaching staff to be vaccinated in vaccination centers, a lot of preparatory work is needed. Schools have to disseminate information and APIs and arrange for medical or health staff to come to schools to conduct seminars and answer questions. These efforts will help to allay concerns and increase the willingness for students to get vaccinated. The government will play the role as a facilitator between the collaboration between these different sectors. Now we have 29 vaccination centers. Since the program has been implemented since the 26th of February, they have been operating from 8 a.m. to 8 p.m. every day, and the capacity is 45,000 doses per day. Every week from Monday to Sunday between 8 a.m. and 8 p.m., the staff are working tirelessly to vaccinate, to administer vaccines. So our plan is that by the end of August, the public would get the first dose, and then the second dose would be administered by the end of September, and then the vaccination centers will cease operation by the end of September. And then depending on the situation, there may be special groups with special needs, and we will make special arrangements. Currently, the vaccination program is led by the government, which is free for all. That is still the case. So we would timely review the arrangements of the vaccination program and make adjustments. That's what we have been doing in the past few months. The friend on this side, I'm from Oriental Daily. Starting next month, primary schools and secondary school students will have summer holiday. Under the special arrangements to provide transport for them to be vaccinated and the outreach vaccination program, how will these options be carried out during the summer holiday? And also for those who get vaccinated like this for the first dose, will similar arrangements be arranged for them for the second dose? Mr. Yang mentioned that when schools have a vaccination rate of 70 to 80%, classes can be resumed. School years will start on the 1st of September, so we will set a limit for schools to get a certain percentage of students vaccinated before a certain date. After resumption of schools, if some teachers are not vaccinated because of health issues or personal reasons, how will you deal with them? I will take the first question. In fact, we are going to have the summer holidays soon. Now, students are having examinations, so it is difficult to ask them to get vaccinated now. Many of them would like to concentrate on the examinations first. So that's why after approving the lowering of age limit, we have begun devising different arrangements to facilitate vaccination. So starting tomorrow, booking can be made online for vaccination and next Monday. And also on 21st of June, transportation service will begin, and on the 28th of June, outreach vaccination service will begin as well. We will strive to roll out to get students vaccinated before summer holiday. In the summer holiday, students will not be required to go to school for lessons. However, if there is an understanding between the school and parents, say on a certain day, a certain number of parents and students would like to get vaccinated at school, then they can go to school on that day to receive vaccination. This is feasible. In summer holiday, only classes are suspended. And also similar arrangements can be made for the second dose. And also, students or parents can make a booking themselves to get vaccinated in vaccination centers. So we are providing the maximum convenience and flexibility for these students. This week, we have met with school principals associations and school sponsoring bodies, and we have updated them on the vaccination arrangements. We are having examination, and summer holiday is coming soon. However, the schools are willing to cooperate. There are different arrangements for different schools during summer holidays. However, they understand the timetable and they have not raised major objections. Now, concerning the other question, I'm not we are not requiring schools to achieve a certain vaccination rate before a certain date. We are encouraging them to get as many as possible to get vaccinated. Still, we are thinking about what more can the school, what activities can be allowed if schools achieve 70% or 80% of vaccination rate. We don't have to set a date before which a certain vaccination rate has to be achieved by everyone. Of course, we hope more schools are able to get such a high vaccination rate. However, we allow leeways in terms of timing. Concerning teachers, I think you mean if a school has achieved 70% or 80% of vaccination rates, but certain school teachers are still not vaccinated, we hope teachers would get vaccinated to set a good example for their students. However, if teachers cannot be vaccinated due to health issues, we still have the regular testing regime, which would enhance the safety as well as the protection for the schools. Let's take 2 more questions. The gentleman on the second row.
Today you focused mainly on the public health message to the students, but do you think that would be enough to get students to get vaccinated? Why have you considered any incentives given to the students? For example, giving them a day off, just like what you've done for civil servants? Or will you call on the business sectors, for example, to give more financial incentives or lucky draws to teenagers to get the vaccination rate up? And secondly, you've talked about, you've mentioned the College of Pediatricians, but actually in a very recent press conference, they've actually said that based on their recent study, that schools are not high-risk places. They found that out of 300 and something COVID-19 children patients, that only 3 of them have caught the coronavirus in schools. So they believe that schools are not high-risk places. And they have told policymakers, they've said, to not close schools anymore, even if there are the 5th wave or there are future epidemic in Hong Kong. So will you heed their advice and actually adopt that as a future policy? And finally, Secretary Nip, you have talked about postponing the delivery of the next batch of BioNTech because of the low demand in Hong Kong. But with the lowering of the age threshold and also with the vaccination rate getting up because of the recent incentives given by a number of government and business sectors, do you think that it is now time to actually book our next batch? And when do you think the next batch can arrive in the earliest possible date? Thank you.
Okay. Thank you very much. As regards the lowering of the eligible age to 12 for the vaccination of BioNTech, of course it's on public health ground, and it is the most important message. And it is for the protection of oneself and also family members. So I think it's very important for us to get across this public health message and also the importance of getting early vaccination. As regards other incentives or encouragements, of course I welcome ideas from various sectors. And as regards the role and responsibility of the government, I think we need to get across the public health message clearly and accurately, and also make the arrangement as flexible and convenient as possible. As regards the medical sector and also the pediatricians, I know that they are very supportive, and they also agree with the importance of early vaccination for school students. The questions that you pose actually regarding on the infection control measures when there are outbreaks. Of course, there are also data showing that among our confirmed cases, there are certain proportions that are teenagers, and some also suffer from very severe conditions. So it's important for them to get vaccination and to have the protection. And as regards the school places, I think we cannot simply judge on whether there were outbreaks in the past to decide on whether school is safe. As you can imagine, if there is resumption of full day class and also the meal break, and with mask-off activities, and also if you allow students to have all these sports, close contacts, sports activities, you can imagine the risk. I think it's just easily understandable. As regards the supply of vaccine, now we have purchased 7.5 million BioNTech vaccine. Is sufficient, together with another 7.5 million doses of Sinovac, is more than enough for our whole eligible population. And we monitor closely about the delivery of these vaccines. And we have adjusted the delivery schedule because originally the whole 7.5 million vaccines will be delivered to Hong Kong in 6 months, and every month with 1 million doses. And based on our take-up rate and also the actual situation, we would have great problems. So we have adjusted the delivery schedule, but at the same time, of course, we would ensure that there are enough vaccines to meet the demand. So we are doing this monitoring work very closely. And I can tell you that at present, I think we have around, for BioNTech, we have around less than 500,000 doses stock. So we would, of course, would monitor the situations and ensure that there will be enough for those who come forward to get vaccinated.
I would like to supplement your question about pediatricians. Indeed, I think many pediatricians have all along highlighted the importance of schooling and maintaining schooling for children in order for them to have a good development, both physically as well as mentally. However, in the midst of COVID-19, there are infection control considerations that sometimes we have to close schools and also in terms of social distancing considerations. So therefore, it is more important for us to protect the children, because many pediatricians also, and recently they have a press conference, the hospital authority pediatrician have highlighted the severe complications if children have contracted COVID-19. So therefore, it's more important for us to protect, the children through vaccination. And so that, as the Secretary for Education have said earlier, that if there are enough or up to a certain percentage of children and teachers vaccinated in the schools, that gives us a better position to have more school activities, so that on the one hand, the risk can be mitigated or protected, and on the other hand, that they can resume these school activities that is important for the growth and development of children.
好，最後一條問題，後邊。
Last question. The person at the back. I'm from RTHK, first of all. In relation to these measures to boost vaccination rate at schools, what do you think the vaccination level will reach for students and teachers if by September the vaccination rate is not as high as 70 to 80%? Will you require regular tests to ensure as a condition to resume full day classes? Will you provide incentives, say in the form of taking your mask off in physical education classes to encourage them? For primary schools, that is, those below the age of 12, when will they be allowed to get vaccinated? Previously, there was a report in relation to the language environment of Greater Bay Area. Has it is it mentioned that Putonghua and simplified Chinese characters will become a compulsory element in the curriculum? To answer your first question, the estimated vaccination rate, we have not made an assessment. Of course, if you ask me, the higher the better. 100% vaccination will be ideal. But we need to take into account the actual situation. Parents will take into account relevant considerations when they decide whether to get their children to get vaccinated. But we'll explain to parents and students the merits of vaccination to themselves and to those around them. If we have 60 to 80% of vaccination rate, of course, certain activities will be allowed. If that cannot be reached, some of these activities will not be allowed. So it's a matter of choice. I think that when it comes to compulsory vaccination, we don't have any plans to do so. Even at this stage, we do not require compulsory testing. I think we need to take into account the actual situation to see what we can do, how much room we have to maneuver. It is premature to say anything at this moment. When can primary school students to get vaccinated? It depends on when experts have sufficient information to warrant an approval to lower the age further. Of course, if that can be done, it will afford better protection to our students. But everything has to be done based on scientific evidence. The health of students and members of the public is paramount. So we have to. So every decision has to be supported by evidence. Your last question is not related to today's topic, but I will give a quick answer. The learning of Putonghua is a part of the curriculum. We've been encouraging students to learn simplified Chinese characters after they have mastered the traditional Chinese characters. In our daily lives, we communicate with mainland residents as well as mainland organizations. I believe that the development of the Greater Bay Area will enhance the frequency of communications and link between Hong Kong and mainland cities. Learning on Putonghua as well as simplifying Chinese characters will bring merits. Sorry, the speaker is off mic. If you refer to the report, I don't think that is the way it's proposed. I think it is about a long-term education plan. We have to think about it very carefully. I'd like to supplement in relation to vaccination. Experts said that should there be 70 to 80% of vaccination rate at schools, there will be conditions to resume full-day classes with a lunch break, or education or physical education classes may resume. That's a very clear message. We should all work together, make use of our facilitating measures to get vaccinated as soon as possible. Depending on the vaccination rate, of course, we don't want classes to be seriously disrupted. We'll put in place anti-infection measures to prevent outbreak. It is similar to the overall vaccination rate in our society. Well, the soundness of the protective barrier of our society will affect the restrictions we face, and it will also affect the relaxations we may be able to allow in order to expedite the resumption of normality and traveling outside Hong Kong. We need a higher protective barrier. I'd like to reply to the reporters about the relationship between vaccination and testing. Of course, vaccination can protect us. It also boosts the immunity of the person against COVID-19. It is a way to protect yourself in the long run. If we can build a protective area, that means our society is protected. In relation to tests, it is to find out if one is infected. We conduct tests to reduce the risk of infection. Well, vaccination is not a replacement of tests, and vice versa. Tests cannot protect students or teachers. Tests cannot boost your immune system. So the only way is to get vaccinated. That's the end of the press conference. Thank you.